Welcome to the ASRM Career Close-Up. I'm Julie Beckham, and joining me today is Colin Thomas, Vice President of Practice Operations at IV Fertility. Colin's career in healthcare administration has been guided by both strategy and heart. In addition to his work in reproductive health, he's a devoted husband and father and an advocate for the cystic fibrosis community. We'll be talking about his professional journey, what drew him into this field, and the experiences that continue to shape his leadership. Colin, it's good to see you. Thank you so much for joining me.
Thanks for having me, Julie. Great to see you.
So let's just dive into the first question. What initially drew you into the field of reproductive medicine? And um, did you envision this specific role early in your career?
No idea that this was an actual field of medicine, nor that I could make a career out of being in this field. And I'm certainly grateful that I'm here now. So my journey into this field of medicine started a long time ago. About 16 and a half, 17 years ago, when my wife and I pursued fertility treatments ourselves. So as you mentioned, I'm an advocate in the cystic fibrosis community. I myself have cystic fibrosis, and that presented challenges for us in building our family. And so we sought out professional care to build our family and learned. My wife and I have 5 beautiful IVF babies through this process, and I found a wonderful home in this field.
Wow, and I did not know that about cystic fibrosis and fertility. Thank you for sharing that. So how would you describe your current role to someone, and like what does a typical day or work week look like to you?
Well, great question. There really isn't, I would say, a typical day, which is part of what I love about what I do. On any given day, there's any number of challenges that come up. I would probably categorize a typical day into 3 different areas of focus. Strategic, which we talk a lot about growth planning, planning for the future, new site development, physician recruitment, new practice acquisition, strategies for helping our current practices grow. Then sort of the operational needs that practices face, reviewing monthly key performance indicators, the patient journey and how we're processing patients in getting patients in the door through their treatment in an effective and compassionate manner. And as we monitor what's needed to do that, staffing ratios, how we help them accomplish the needs of managing each patient's needs. And that ties into the third area that I would say we have a lot of time and focus on in any given day, which is centering around the people and helping the practices, whether it be their nursing staff, their lab staff, their admin staff, in whatever aspect they might have struggles in that given day.
Okay, and so what skills or experiences do you think help contribute to a success in your role? Like maybe even some that you wouldn't expect that you would need.
Great question. I think obviously by the nature of my role and responsibility, operations, I think having an understanding of practice operations is critical. But fertility care is a really deep and personal journey. And so understanding what patients are going through in that process, unlike, probably several other areas of healthcare, it's really, I think, critical to have high emotional intelligence to be able to engage with the patient at their level and help them navigate this process. For anybody in our field, right? Whether you talk to patients every day or not, I certainly in my role don't talk to patients every day, but being able to help our practices and the staff who do talk to their patients every day manage their patients' needs is critical. Having a good understanding and knowledge around change management processes, whether we need to help implement a new EMR or standardize a protocol or a workflow, understanding what the barriers are to those changes, and then navigating through those changes to get to outcomes that everyone can agree on and align on for the betterment of the practice, which ultimately betters the patient in being better able to serve the patient.
Mm-hmm.
Um, And that creates sort of almost a diplomacy kind of mindset. You have to be able to align physicians, clinical teams, embryology teams, administrative teams, financial teams, so that we can all work through whatever questions or concerns are present at the moment and navigate that process to have an effective outcome and move forward together.
Yeah, that sounds like a very comprehensive skill set. um, so, what are some of the biggest challenges that you face in your role, and how have you learned to navigate them?
Over the course of the several years I've been doing this, we continue to face rising costs in healthcare, which I think is a challenge, both in terms of the costs we face, but also in the changing models of reimbursement. So how do we manage effectively running practices whilst maintaining profitability, I think is important.
Yeah.
How do we leverage, this has been ongoing, but I think in our current day and age with the full force of technology coming at us, how do we leverage and manage the use of technology in our field? And now the conversation has shifted from, technology developments in equipment to technology developments in software like AI, and how do we manage and utilize that? I don't have great answers for that yet because I'm still learning myself, but I think that's important to figure that out. And then navigating the workforce. We've got a workforce that has a different need now and is always connected, which also matches our patient need. And so how do we make sure that our workforce is matching our patient need? As I said, this is a deeply emotional experience for patients and field of medicine. That can also lead to high burnout because there's constant needs from the patients. So how do we help manage our staff in taking care of the patient's needs, I think are some of the challenges that we faced.
Right. What misconceptions exist about your career path or your line of work?
I would say that I think one misconception is that sort of the operations side of the house or practice operations is purely an administrative role, that we just focus on process and efficiency and dollars and profitability. And I think that can be true, but I think the misconception is that for this role to be truly effective, or administrative side of the house to be truly effective, it really is understanding the clinically adjacent side of the house and how everything we do in our field revolves around the patient journey. And that we're not just healthcare executives pushing profitability, that we actually truly care about the operational and clinical needs of the patients and making sure that they're effective and efficient for the patient as they go through the process, for the staff as they're supporting the patients through the process, which I'm a firm believer, if we're all aligned and we're all doing things right, then profitability will come after the fact. When we do the right things in the right way and for the right reasons, then everyone's happy, everyone's aligned.
Okay, thank you. And how would you say the field and or your role in it has evolved since you first started? How long have you been doing this?
I have been doing this for longer than 15 years. Yeah, longer than I can count on one hand. So,
Have you seen a big evolution in the field?
I have. I think. Yeah, I would say. I think the field, and like when you say the field, you mean reproductive medicine or like the business side of the house?
Yeah, I mean maybe IVF specifically in reproductive medicine.
Um, the genetics continues to evolve. It continues to be a discussion of ever-changing technologies and abilities to dive into specific disease states like cystic fibrosis. I was actually just talking to someone who I was telling them the difference between PGTA, PGTM, PGTP, and they're like, wait, I thought it was called PGD. I
Yeah,
was like, oh no, that's nomenclature from a long time ago.
that was
We
so
we changed that
2020.
significantly. Um, so it has been fun to watch how things have developed in and advanced scientifically for sure.
Okay, so who or what has helped open doors for you along the way?
Oh, fantastic question. Do you want me to name names? I've
If
got a
you want to
list of
name them, yeah, name them.
them. Well, I think there have been several people along the way that have been mentors to me in my journey. One was my actual personal physician when we started this journey, Dr. Peterson, who was the one that actually encouraged me to be in this industry. And at the time of our fertility treatments, my wife and I's fertility treatments, I was in the process of getting my master's in healthcare administration. And so I was sort of had that hat on, that learning hat and thirst for knowledge, and said to him, how do you make this, how is this a business? How do you run this as a business? And we went back and forth a lot of times. He ended up offering my first job and asked me to come run their practice there. So that's how I got into the field. Um, and then another physician at that practice a few years later really encouraged me to get involved in the professional societies like ASRM and ARM, and he was instrumental to supporting me learning and growing in what our professional societies do, starting speaking at conferences and talking about the business of medicine. That's what we call it today, but we
Yeah.
didn't call it that 15 years ago. So they've been really critical in sort of the entry career path for me. But even today, there's several peers that I have in the field that continue to both provide mentorship and support to me in my involvement with the ARM group and the other professional groups that have been really instrumental and lifelong friends that we've made because of it.
And so you've been really involved with ARM. You want to talk about that a little bit?
Sure. Yeah, I got involved in ARM a really long time ago, and have really enjoyed learning from that professional group. So ARM is the Association of Reproductive Managers. It's a professional group within ASRM, and it's business professionals running fertility practices, not exclusively practice admins. We've got laboratory managers, basically anybody in a leadership role that has the opportunity to help run the business of a fertility practice is where ARM can help support. And we've got mentorship programs, annual meetings that we bring ideas and lectures to help people understand what the process is and how we can help better run our businesses in our fertility clinics. And I've been really glad to be part of that. There's continuing relationships I've made there. We have a mentorship group that helps support the newer generation of individuals helping run practices, and it's one of several professional groups within ASRM that are really beneficial.
And it's really remarkable the growth of the ARM meeting, now a joint meeting with the nurses professional group, but it's really skyrocketed from even like the last, within the last 5 to 6 years. And I know you had a lot to do with that.
Well, it took a lot of people to get to where it is today. But yeah, it's been great. I remember going to a conference when I first started. I think we had maybe 30 or 40 people there, and I think the conference this month is over 200, which is going to be fantastic.
So, what's one piece of advice that you wish you had received earlier in your career?
So one of my mentors taught me a phrase called ABI, always be improving. And so to have that mindset is that we can always be improving. And it doesn't, that progress shouldn't come at the expense of perfection. And so whatever it takes to get where we need to go, right? Whatever that journey, if it's a question we're trying to answer, if it's a solution we're trying to put in place. Sometimes the best action we can take might not always be the right answer that we get to at the end of the road, but we've got to take that first step. So just do it, and you can improve along the way.
Yeah, I subscribe to that as well. Any last words, final thoughts?
Yeah. One of the experiences I've had is, as we talked about earlier, being an advocate in the cystic fibrosis community. I think some of the skills that I've both learned in my career, but also in this field, is through the foundation that I'm now grateful to be part of, which is the Philotimo Foundation. They're a foundation dedicated to the support of adults with cystic fibrosis. In specifically, the role that I advise for them is how to help other patients with cystic fibrosis be able to build their families and have resources, education to do that, including the financial resources to do this. So this foundation provides grants to families with cystic fibrosis to build their families and go through the fertility process. Whether the husband or the wife have CF, we're there to support and help them go through the process and build the family of their dreams free of cystic fibrosis and not passing cystic fibrosis on down to their children.
And how can people learn more about that organization?
Yeah, absolutely. They can go to philotimofoundation.org. It's FILOTIMO foundation.org.
Okay, thank you. And Colin, thanks so much for being here today. We learned a lot about what it's like to work on the business end of reproductive medicine. And we'll look for you at the RMMPG meeting, right?
Yes, please look forward to it. Thanks for having me, Julie. It's been a pleasure to do this today.